Okay, I can't really see what I'm recording here, but just to let y'all know, I don't know how well you can hear me or if you can even see me because I can't see what I'm recording. But it's been a while since I've been able to meet my friend Mary for coffee due to this COVID-19. So, thanks to Mary, she had a wonderful idea that we would social distance while getting our coffee. Like I said, this is going to be a tricky video, so I don't know how well I'm going to be recording it. So, you see I've got my McDonald's coffee. And there's my buddy.
Good morning. I'm over here more than 6 feet away. I first want to show I have my 2 coffees. And not only that, because we all know I like to eat, so I have breakfast this morning. But this is what I affectionately call my nut sack. I just want to show everybody that we need to wear these. If you get mad, you don't want to wear them, and you think you're okay because other people are wearing them and that you don't need to, let me explain the mask to you. The mask keeps your droplets to yourself to keep from going out there. So me wearing a mask, I'm protecting you. And so I want you to protect me. This stuff is not a joke. I work in healthcare and it is not fun. I've had friends with family members die from it. I have 2 friends currently recovering from it. It is no joke. Please, people, wear your mask. Other than that, good morning.
And I appreciate her strong words there to encourage people to wear their face mask. And as you can see, I've got mine on too. And people probably know I really have a problem with people out there who refuse to wear a face mask and who say this virus is a hoax. Trust me, it is not a hoax. I mean, did y'all think that all the doctors, all the hospitals, maybe from all the countries all across the world, I don't know if people think that they maybe all had a meeting that we're not aware of, say, hey, let's just create this COVID-19 hoax. And so I don't know what people are thinking, but please wear your face mask. I have had type 1 diabetes for 31 years. And so it really, really scares the daylights out of me to think that I could become infected. Although I don't go anywhere. But it's because my husband is considered an essential employee, so he has to work. And he is surrounded by people from all over the world. So, as you can see, we are even doing our social distancing with our cars. I don't even know if you can see my car. And even with our face mask on to drink our coffee. So it's very important, as Mary said, that you wear your face mask to protect yourself, protect your family, and protect everybody around you. But anyway.
And watch the news.
Exactly.
Another wave is coming through. Texas is being hit right now, and they're looking for refrigeration trucks for the bodies. I have not verified this source, but I just read that South Carolina is going back to phase 1 because they opened up those beaches and everybody went flocking down there. So that is unverified at the moment, but something we need to be mindful of. We're going to never get over this if we don't start taking it seriously.
Yeah, and see, that drives me crazy because it is because so many people are not taking this serious, and it drives me crazy. Because, like I said, I've been terrified of this, and to the point to where, you know, I haven't even met Mary out here. And I say I haven't even met her out here for coffee. Yes. How long has it been? Yes, it's been a very long time. Just because, you know, I've been scared too. Even just sitting here in my car, even with my face mask on, even with Mary at the distance she is. You know, I'm still nervous, but you know, I can't help it. A lot of people are just taking, just don't care. I mean, let me tell you, I posted a comment on my Facebook wall. I probably shouldn't be talking about this, but I'm going to. Posted a comment on my Facebook wall recently, about the stats that's going on in North Carolina right now with the COVID-19, and just asking people to please wear a face mask when they go out, and explaining about my situation with my compromised immune system. And somebody actually cussed me out on my wall, and I did say at the end of my message, if you have a problem with my comment, go to your wall. Don't be arguing on my wall. And this person cussed me out and used the F word and used bull S. I don't cuss, so I'm using abbreviations. But and of course, then before I could remove him from my Facebook list, he removed himself. Which of course then I went blocked him. But I mean, I think it's ridiculous. Everybody's entitled to their own opinion about it, so I think it's ridiculous. But I don't know if you saw that, Mary, where somebody actually cussed me out on my wall.
All I can say is the trash took itself out.
Exactly, yeah. So, but I mean, yes, this morning, oh, look at the pretty bird over there. He's coming to join us as well. See the pretty bird? He's joining us for coffee too. Oh. You come on over here, bird. Okay, well, he left. I guess he didn't want to join us for coffee, but anyway. So, yeah, so this is the first time we've actually met for coffee. And what'd you say, 4 months now? It's been a long time.
So we probably are not going to be out here very long. I allot it for an hour, but I know Laura is nervous, and so we just wanted to see each other face to face for a few minutes. I'm going to let her go home because she has to deal with her husband working with the public and bringing germs to her, so we're not going to keep her out very long.
Yeah, and my memory is so gone when I was getting ready to say something. Now I can't remember what I was going to say. My memory is gone.
And are we surprised?
No, we're not. I don't know if y'all heard her. She said, and are we surprised? With my memory, no. But yeah, and as I said earlier, you know, we are out here, you know, we're going to, even after I stop filming, we're going to chat for a little while. But even so, even with our face mask on, we're still making sure we're protecting each other so that we can therefore protect our families when we leave from here. And even in our cars, we're social distancing. So we're trying to make sure we stay safe. And I really appreciate Mary, because Mary is a, oh, see, my mind's going blank again.
Pharmacy technician, healthcare worker, work in a hospital, what?
So she is always protecting herself and protecting those around her.
Absolutely.
And see, I wanted to bring that up because she's protecting everybody else too. And I just want to say, Mary, I really appreciate you for doing that.
You're welcome.
And I appreciate everybody out there who is trying to protect others. I actually heard, and I was surprised. I saw a woman on the news not too long ago, maybe a couple of weeks ago. She was being interviewed about face masks. She was not wearing a face mask. And she basically said, she was giving her thoughts on wearing a face mask, and she basically said, well, I don't want to be losing my freedom, and you're taking away my freedom, and it's not that many people who are dying anyway. And when I heard her say that, it was almost as if she was saying, well, it doesn't matter about those who are dying. You know, it's just one person dying to me is bad.
Exactly. And that is the whole thing why I think people aren't taking this seriously, because it is true. Statistically, the deaths are extremely low. The thing is, though, you and I have been around this world for a while, and we have had chickenpox our whole lives. We've had the flu. We've gone through the pandemic of HIV.
Yep.
We've gone through all these things, and this is brand spanking new. And we don't have a whole lot of information. We're making strides every day as far as medications and treatments. But like you say, one death is too many. But the people that I know that have are recovering from it and that have family members die from it, they say it is excruciating. It is worse than the flu, and we all think we're dying when we have the flu. They say your air is literally sucked out of your lungs, and then when you have to be intubated because you can't breathe on your own, that is not good. People who wind up in the hospital with it and going on intubation, they're in the hospital an average of 30 to 60 days. So it's not common cold or flu. It's excruciatingly painful. And
Yeah.
so the only thing we know about it is to distance and wear a mask. So until we can get our healthcare system
And wash your hands. And wash your hands.
you know, hand
Yep.
sanitation, but
Yep.
I'm just saying, we have to give our medical community time to research, time to develop a vaccine, time to come up with effective treatments. And this is our part to slow it down so that they can do their part.
Yeah, because this morning on the news, I was actually watching the news before I came over here, and there was already near 85,000 confirmed COVID-19 cases here in North Carolina. Although I think about 30,000 of those people have recovered, and I think there were somewhere over 1,400 or near 1,500 deaths. To me, that's a lot of deaths. And I keep having people want to argue about it and say, well, more people than that die with the flu. But I haven't heard those stats, but I'm not saying that's wrong or incorrect. I'm just saying with so many people getting sick with the COVID-19 right now, so many people dying, and you have all these horrible complications from it, especially those who are elderly and people with underlying health conditions, such as myself. So you need to put yourself in my shoes, and if you were to have a scary disease enough as it is with just having type 1 diabetes, how would you feel, knowing that there's so many people out there basically saying, F you, I don't care about your life, basically is what I was told the other day on Facebook. So it's really bad. I mean, I feel like this has, it's just crazy, and it's frustrating. So
I got one last thing to say on that. 5 weeks ago, a colleague, 29 years old, passed away with COVID. Her brother, it made national news, is in Chapel Hill. Her brother said that the air just sucked out of her lungs. Can you imagine dying such a horrible death? One of the people I know recovering is a 35-year-old mother of 3. So it's not just people with health problems. But let's get back to the statistics for the moment. Yes, statistic-wise, the death rate is lower than the flu. But let me put it to you in more plain and simple terms. Even at a 1% death rate, you line up 100 people of your close friends and family members, and you point to one and choose which one do you want to go through this horrible illness, excruciating death, and you never see again. And if that doesn't wake you up, nothing's going to wake you up.
Yep, amen to that. So, but anyway, I guess we're going to get back to our coffee drinking now, and since we haven't seen each other in probably about 4 months, so enough of that. We're going to go back to our drinking coffee and enjoying our coffee and enjoy each other's company. And what was that, Mary?
Eating biscuit.
Yeah. And so, but anyway, we just wanted to, let y'all know our thoughts on social distancing and wearing your face mask, and know that there is a safe way that you can still meet friends. Just please do it in a safe manner. And if everybody would just practice social distancing, wash their hands, wear the face mask, we can hurry up and get through this pandemic. Because I, for one, would like to be able to get back to a fairly normal life. So anyway, we're going to get back to our coffee and enjoying each other's company. Alright, so we shall see you later. Hopefully real soon.